I'm Steve Roffel, the Program Manager of the VACC Skills Development Centre. We wanted to develop a program that would assist automotive employees in improving their mental health, as we knew that, like most industries, mental health related issues were having an effect on workplace wellbeing, workplace productivity and performance. We see this program as another way of helping our members, as well as the industry as a whole. The VACC Skills Development Centre and VACC OHSE unit had begun talking about improving mental health within workplace environments, but we knew we would need advice from organisations who have experience in developing targeted workplace health programs. Alcohol and Drug Awareness Australia, ADA Australia, were already providing great training to our apprentices and advice to their field managers, and had expanded their support into the mental health field. So it was natural for us to ask them to be involved in the development of the program from the start. Having secured their support, we reached out to our industry groups to get their perspective and talked with our group training scheme field managers on what would work within the automotive industry. And once we got everyone together, the concept for the program developed very quickly. The design of the program was always around the concept of face-to-face engagement with the decision makers in the workplaces. Automotive industry training programs are most effective when people are available to consult at the workplace. We were going to need to touch base regularly with business owners to keep them engaged, so we would employ facilitators to be on the road visiting the workplaces. In addition, there needed to be a single and obvious framework for the owners to work within so they could see themselves ticking off initiatives and improvements that align with the overarching risk factors, such as unreasonable behaviours or workload stress. That's why we decided to use ADA's Little Blue Book of Workplace Mental Health, as it was laid out around a relatively small number of mental health risk factors that would form the core of our framework. Business owners would have the tools available in the Little Blue Book, as well as a dedicated website built around the framework of mental health risk factors, and the WorkWell toolkit, which would allow more in-depth examination and management of each factor. To document this, each participant would be given an action plan booklet, which, like the Little Blue Book, would function as a physical reminder to the owner. And this would be the first thing facilitators would look at on each visit to prompt the owner to keep working on the program. We also wanted businesses to be able to collaborate and share learnings and initiatives with peer businesses. So we would establish community hubs, inviting participating and other local businesses to get together with subject matter experts. And these hubs would normally take place in face-to-face settings where participants could feel comfortable. There are a number of different parts that needed to be put together before the program could actually be offered to businesses. We engaged a website development company to help us out with the website and recruited 2 facilitators from the automotive industry, putting them through relevant mental health training. The facilitators were deeply involved in the development of all the resources, as their knowledge of the industry gave insight into what would and wouldn't work in businesses. The website was a primary source of information for participants, and we were able to add a link to a bespoke WorkWell toolkit resource that took advantage of the resources that WorkWell had already built. It's impossible to talk about the rollout of the program without talking about COVID. COVID affected every person in Australia, and as a result, every aspect of the program. The start of the program coincided with the first lockdown here in Victoria, so everything was delayed, and all we could do was simply keep forging ahead. COVID slowed the development stage, it prevented our facilitators from going into businesses, it meant that the overriding priority for businesses was just trying to keep their head above water. But conversely, COVID also put a spotlight on mental health in the community, as people struggled to cope with the many aspects of the pandemic. In particular, the program's community hubs were affected, as people were, understandably, very reluctant to gather in groups. Once restrictions eased, we were able to get into businesses, but people were still being impacted, either directly or as a close contact, and it was hard to establish any continuity to the program. Having said that, we've had 250 businesses come onto the program, and our facilitators have reported that automotive workplaces are much more aware of mental health, and they've really appreciated a program that is designed for the automotive industry.
I'm Tim O'Brien, I'm the CEO of ADA Australia. We work with businesses and with many large organisations around creating a mentally healthy workplace. Part of that work, of course, we work from the top down. We work with managers, middle managers and business owners. And we work with them on their compliance obligations around mental health, but also in practical ways, the things that they can do basically to make the workplace psychologically healthy. Our view, in ADA Australia, with the work that we do, is that no one should go home carrying the weight of work, on their shoulders. ADA has been working with VACC now for quite some years. I mean, we're 6 years old, but certainly, at least 3 or 4 of those years been working with VACC. Our people, train VACC apprentices. One of the things that we've identified, many people running apprenticeships, I know VACC does, is that we lose apprentices to problems that are outside the tools. We were very pleased to hear about the WorkWell project and very pleased when we heard that VACC was getting involved. In working with VACC, we spent quite a bit of time, sort of really nutting out as to how we can get this from VACC head office and from what was sitting in our heads, out to those varied and vast constituency of VACC members, where you've got dealerships with many, many staff, and then you've got mum and dad businesses. I think that the plan that we landed on, running, small hubs and bringing members together to talk about mental health, to talk about, some of the problems, that they'd encountered in their business, which is a really natural place to start, and to talk about how, by adopting a preventative approach to psychological injury, and there are just some really simple human things, that you can do to build the culture in your business. So getting those businesses together and to have those discussions, that was a really good idea and became the foundation for the way that we disseminated and the way that we made it work. I'm the author of this publication, the Little Blue Book of Workplace Mental Health, and a couple of other publications as well. Much of the foundation work was done in terms of the kind of information that we were going to be disseminating. We had many meetings, both high level but also just sort of working meetings, where we decided, really what the key messages, were going to be to align with what, WorkWell was, the aspirations of, what WorkSafe was doing with WorkWell. We worked really closely, and in fact, the articles we produced and all of that information that we produced that went with it had a really tight focus on that automotive constituency. I think VACC correctly realised, that we needed to have this talking to them as, workshop owners. There's no better way of opening a conversation than someone thinking that, well, you get me, I get you, that sort of thing. Look, I think the VACC program of having, facilitators out there talking face-to-face to businesses, but also having the VACC area managers engaged, it's just such a good approach for something like this. We found the hub meetings, it was in fact an eye-opener, because from my point of view, I didn't expect, to find people actually quite so willing to open up. The hub meetings were really valuable for a couple of reasons. One, in the first instance, to provide a forum, if you like, for business owners to open up about their own feelings, but also to provide the forum to have them to be more receptive, I suppose, to be more alert to struggles that some of their people, may be having. And as far as I'm concerned, even if we achieve those two things, that's a job well done.
I'm William Joy, and I'm a facilitator with the Fine Tuning Automotive Mental Health Program. Hi, I'm Michelle Dunning. I'm one of the facilitators for the Fine-Tune Automotive Mental Health Program.
The aim of the program was to raise awareness about the impact of mental health in the workplace
And provide support for the business owners and managers to support their employees in mental health wellbeing.
At the first meeting, I would go out and discuss the program. I would log into the fine-tuning website program, run them through, and then go through the WorkSafe, WorkWell toolkit.
The toolkit provided a practical step-by-step to assist business and managers, providing them with resources and guidance in the mental health of their employees. I also provided them with a resource pack. This contained the mental health posters, the little blue book and the action plan booklet. Following my first visit, I would then rebook them for a 6 to 8 week period. This allowed me to give them time to work on the program, and also when I came back, I provided them with extra support and information to help them with the program.
250 businesses participated in our program, and they were both across metropolitan and a number of regional areas. The program has been very well received within all the businesses participating. It raised awareness about the risk factors of mental health in the workplace, and they're happy to have resources at their fingertips.
During the COVID lockdowns, we had to change the way we did things. We had to post the resources out to business because we were unable to go visit them. Once the resources were posted out, we also followed up this way via the phone calls and team meetings in the 6 to 8 week period until we were able to go out on the road with them. We had to be flexible and adapt quickly to the ever-changing environment in which we were working in. This was an extremely difficult time.
One of the challenges that I noticed was managers are fairly time poor. They're spending more time in the business than on the business, and COVID added extra pressure to that, to everybody. Managers are more aware of mental health through our program and the impact of COVID. However, they may need to build their skills and knowledge to address issues in the workplace. That's why our program and the WorkWell toolkit are so useful. They provide an easy starting point regardless of the level of management expertise. Throughout the program, I've seen a greater awareness and understanding of mental health in the workplace. The majority of businesses have used our resources. I've seen posters up in the workplace, seen the little blue book on the shop counters, in the lunchrooms, and managers encourage their staff to read them. Many managers have set up more regular toolbox meetings. They've said that the resources have assisted them in starting conversations about mental health in the workplace. We've found that policies and procedures have been reviewed, and there's been an increased awareness about the importance of having a comprehensive induction program.
It was great getting to know the people behind the businesses and listening to their stories and challenges that they have. I have received a great lot of feedback in regards to the program and how it has improved their businesses. They've used our resources, our website, little blue books, and also the WorkWell toolkit that they've found very beneficial to their businesses. It's been a very challenging year, 2 years due to COVID. Many obstacles have occurred in our way. We had to be very resourceful and adapt to the ever-changing environment, but it's been very fulfilling and one that I feel that has benefited the automotive industry greatly.
It's been great to see that the program is really making a difference within the automotive industry. Some of the key learnings we have from the program is it provides a way for employers and employees to talk about mental health. I think by having us out on the road, meeting with businesses face to face, you're able to create that relationship with the managers or supervisors. It was clear that every business we visited, it was a preferred method. The amount of resources provided to the businesses allowed them to cherry pick what was most useful for them. Occupational health and safety has always been understood from a physical standpoint. However, there's more need for education around mental health in the workplace. There's been an increased focus on psychosocial hazards involving concepts that are not well understood by a large number of employers, and they're going to require ongoing support.